Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Docs, welcome to another episode of Modern Chiropractic Mastery. Today, I'm excited to bring Dr. David Seaman to the podcast for the first time. I surprised it's taken so long for me to finally ask him to be on the podcast. He's one of those instrumental people in my education over the years and how it's come full circle. I remember being an early chiropractic student at Logan, probably 2003, and hearing him first speak. And then I've been fortunate enough to get to know him, playing golf with him, having dinners, kind of speaking on the circuit together, and really always enjoyed his education, his company, and even his golf information. It's something that we've always connected on. And today we're going to really dive into how you can integrate nutrition into your practice. And it doesn't have to be this overwhelming, complicated thing. And you don't have to be a registered dietitian to do it. And he, as usual, just brings a ton of great information that's easy for you to digest, and also communicate with your patients, and how this can really play a huge factor in the conditions you're treating with, manual therapy and rehab. And sometimes we're missing this inflammatory component to it. I shouldn't say sometimes, most of the time. And so we dive into that in this interview. And as usual, he is always entertaining and a great conversation. And so we dive into various topics around that, and also how it applies to your private practice and what you can do for your patients. Before we dive into that, just to give you the update on MCM Mastery, we had reached our 45 member number at the end of the year and onboarded all those folks. In case you're wondering, we are accepting new members, and we've got some streaming in here in January. And what we're excited about, the overall program has just been great since we transformed it back in the summer of 2022. And we just actually launched a team training component to it. And so now if I had to give you kind of the three parts, and there's a little bit of subcategories under each of them that I won't dive into much here, but you could always go to our website, modernchiropracticmarketing.com, to reach out to me and dive more into it. But we're really three things now. We're coaching, everything business, communication, business systems, practice systems, finances, marketing strategy, really having a coach in your corner. Second is we do the marketing for you now, and that's a big part of what we're doing, and our members are loving that. And then third, we've added team trainings, and we just had our first one in January here on front desk team trainings, and we got a ton of great feedback on that. So each month we'll be doing 2 calls. Some will be for front desk, some will be for clinical CAs, some for your associates, some for you, some maybe for your marketing team. But the training sessions are a little bit different than the coaching sessions for the chiropractors. Check us out at modernchiropracticmarketing.com if you want to check out our marketing and coaching and training for your practice, so you're not left on an island anymore. All right, without further ado, here is my interview with Dr. David Seaman. All right, welcome to the show, Doc. I really appreciate your time today. I'm excited to discuss all things mechanics. No, I'm just kidding. It's an inside joke, audience. Though we're going to dive into a bunch of different topics and really dispel some myths and have a little bit of fun while we do it. So, tell our audience a little bit about yourself, Doc, and we'll go from there.
Well, I graduated from Rutgers, so went to college in New Jersey, and then went to New York Chiropractic College. And when I was in chiropractic college, my undergraduate degree was biology/nutrition. So when I was in chiropractic college, I was interested in actually applied kinesiology and SOT, because those were the only techniques that actually talked about food. And I knew that food was definitely important to some degree. I didn't realize how food actually creates an environment that will either help to repair musculoskeletal tissues efficiently after wearing them. Because really, if you think about it, when you exercise, you wear and then you rest to repair, right? Yep. So you actually tear with exercise and then you repair. Well, so we wouldn't like work our biceps every day to the max, right? You got to rest them so you repair. And so that's how the rest of our musculoskeletal tissues work too. They wear and they should repair. If we have an unhealthy biochemical state, then we will wear and not repair, will degenerate, and down the road, the imaging looks like a tear. But you cannot tear biological tissues in a very in a slow kind of way that you can with an actual, say, sports injury, where you can actually tear something, sprain something. Most people develop their symptoms gradually over time. And you think, degeneration is part of it, which is true. But what degeneration is a lack of an ability to repair tissues over time. And if those two things are not understood, then we artificially separate out mechanics from chemistry as if they're somehow separated when they're not separated. So that's kind of where I am now. But I started thinking about this because I was sitting in a neuroscience class, my first post-grad class, because when I was graduated college back in the old days when there was still dial-up, I guess, in the early 80s or late or mid 80s. Oh heck, I started thinking about dial-up and I started laughing.
Well, I
Shoot.
wasn't even dial up back then. It was rotary phones probably for you.
Rotary, yeah. Yeah, it was a rotary, and so we have push button too, but and they just started to have the wireless. But back when I was in school, oh heck, I forget. It was a really good point, and I'll think about it. But anyway, so I got my I took a class from Dr. Barry Weick, who was a pretty famous neuroscientist. He was the first medical doctor, neurologist, researcher who was really a friend of chiropractors. So us chiropractors who were raised in the early 80s and mid 80s, we really liked this guy. He came to NYCC, around to school 2 or 3 times. And then after I graduated, I took almost a 15-hour class with him. And he was talking about pain mechanisms and manipulation mechanisms. And when he went over pain, he showed a bunch of the different chemicals that irritate nociceptors. And I'm sitting there for the first time, and I'm going, man, look at half those chemicals I learned in undergrad and in chiro, and I know that they're related to diet. So I thought to myself, I wonder if we can literally eat ourselves into and out of pain. And that got me going. So I ended up collecting about 10,000 photocopied articles in the scientific literature where I retaught myself physiology on my own after graduation.
That sounds like a good time.
Yeah, and I didn't have kids, didn't have a wife, so I was like, it was just me and information. So it's like, you just have. I mean, imagine having nothing, no dogs, no cats, no kids, no nothing, no in-laws, no nothing, and then the amount of time you have, right? So that's how I did it.
Yeah. I remember back when I was probably 28. Similar, no kids or family or anything. I wrote my first little golf manual. I know you and I have a lot of golf in common, and I used to just come home at night and write and write and write, and now I can't find a minute to read or do anything.
So I'm 63 this year. So I've been like that for several decades. So yeah.
Yeah.
So
So your production has been very good.
yeah, particularly since the COVID thing. I probably wrote like 4 books since COVID started, I think.
Yeah.
Actually, at the very beginning of COVID, before I started, I published one and then I wrote 3 more and modified 1 since then. So yeah, so it's been pretty busy writing. Yeah.
Well, good. My first exposure to your work was actually probably in 2003. I was a chiropractic student early on at Logan and saw you speak. And I know the last time we had dinner in Columbus a few months back, I was telling you how I went home and I made that ginger tea, the whole
Yeah.
9 yards, and I was drinking that, and the little anti-inflammatory concoction that really would light your nose hairs on fire after you're drinking that.
It's really interesting. Because I before the whole COVID thing happened, I would still go and do stuff at the schools, and oftentimes, students would come for whatever reason. And this one student, I'm not going to mention the school just because they're all like this. They all fail the students in this regard. So here's a student who had it was either ulcerative colitis or Crohn's, and he had a colostomy bag, and he would drive home from school, and you have to stop and empty the bag and deal with it. And so this is the first 12-hour class of 3, And he's telling us the next class that he drove home after he changed around what I suggested, like get rid of sugar and flour, refined oils, increase your vegetation, whatever stuff agrees with you vegetation wise. Don't run away from fat. If you like bacon, eat more bacon. I mean, don't like only eat bacon, but don't be afraid of bacon. Be afraid of French fries, that kind of thing. So he didn't say anything. He just kind of, I guess, was taking notes. He changed everything around. He's driving home, and he drove home 5 hours and didn't once have to stop for his colostomy bag fix. He gets home, he's like, "Oh my God." So even with ulcerative colitis or Crohn's, his life was completely changed by getting rid of sugar, flour, and refined oils. And that is the main thing. And we need to do that to whatever degree we need to based upon our individual needs, which would be different for, say, me or you compared to a guy who has part of his colon not there.
Yep.
So, and if you're a gluten sensitive person or a celiac person, then you have another layer of complexity to deal with. But most people, they just need to stop overeating sugar, flour, and refined oils. And one of the things that because I try to think like, talk about this so that, DCs and DC students who have been inappropriately conditioned to view the human body movement as mechanical and that chemistry is somehow separate. Like, how do you kind of orient this? So one way to look at it is, so whenever you take, for example, carbohydrate like, say, potato, you put it into a deep fryer and you fry the crap out of it, you create advanced glycation end products, which in the only one we really measure in clinical practice, if anyone does, is hemoglobin A1C. But when you heat up at high temperatures with oil, you make a ton of advanced glycation end products in your French fries, preformed in potato chips. So these advanced glycation end products that we eat, they actually bind to connective tissue and initiate degeneration of our so-called mechanical tissues, because they're not really mechanical, they are structural. And so the collagen proteins, there's an affinity. There's actually a receptor in chondrocytes for advanced glycation end products. It's called the receptor for AGEs. So the receptor is called RAGE. The RAGE, the
Which
RAGE
causes
receptor,
you to age.
which causes you to age. Exactly right. So my orientation way back then was initially, and the thing too that was nice for me back was basically 86, I guess, 87. When I asked Dr. Wyke on Sunday, because I went home, got my chem books out and my nutrition book, and I'm like, look at this, omega-3 fatty acids, they make anti-inflammatory prostaglandins. He talked about a pro-inflammatory one. So during the first break on Sunday, I asked him, I showed him the book. He was like, that's interesting. And even if he said, Seaman, you're crazy, I wouldn't have taken it too seriously because he was busy sipping a Coke, And so he didn't really have a good, connection between food and health and all that kind of stuff. He goes, that's interesting. I'm like, cool. And that's what got me going. So I went kind of crazy after that. Yeah.
So I want to touch on a little bit because you mentioned it, and we were talking about it pre-chat, which was why I was kind of joking around on the early part of the introduction about mechanics. And we do hear a lot about that in our evidence-informed chiropractic field, whether we're talking about rehab or movement or McKenzie, things like that. A lot of the term mechanics is thrown out, and we a lot of times forget about the biochemistry, the chemical aspect of it. Can you dive into that a little bit more and kind
Yeah.
of talk about the irony of it a little bit and the reality of it, and give us a good picture of that?
Yeah, it's actually interesting. That's why I think everybody listening now should go online and just put into their search window whatever they're doing. If they're googling it, do it there. If they're a little bit suspicious and they're doing DuckDuckGo, that'll work too. What you want to do is put in Weston Price, Weston Price, and then click images, and what you'll see are images of the native populations that Weston Price visited back in the late 20s, early 30s. So he traveled around the world to various cultures, islanders, Eskimo, so North, South, Congo, all over the place. I mean, this guy went everywhere, South America, and wherever he found native populations, he would look at the natives who were not exposed to Western calories. And back then, the main Western calories would have been sugar and flour. Eventually, they brought in like the refined oils and the Crisco-y stuff, those sugar and flour calories. And he found that wherever sugar and flour calories were adopted to a sufficient enough degree, there was noticeable physical degeneration, particularly in the dentition, which makes sense. You eat sugar and flour, your teeth will decay. And the reason why is because the sugar and flour basically feed the gram-negative bacteria in the mouth, and then they proliferate and they create a local inflammatory process, and then you lose your teeth. So it's a very obvious degenerative process. Well, wherever Weston Price went, he saw profound differences in dental and in some places even appendicular skeleton as well, posture and all kinds of stuff, jawbone changes, teeth narrowing. I mean, massive physical changes as a consequence of no longer eating what you could call a paleo diet. Now, paleo diet, is also confused because of the hucksters that are out there compared to the original paleo guy, which was Lauren Cordain, who wrote The Paleo Diet, and his website, thepaleodiet.com, is, I think, the only paleo website anyone should go to. But when I first started looking at that, I'm like, paleo is not the right word. They should call it the Paleolithic latitude diet, because that's what it really is. Think about if you're an Eskimo, you're not going to be eating the same kind of calories that you would if you were in, say, an Amazon native, right?
Yep.
So wherever we are, our latitude determines the animals and the vegetation that are available to us. So whenever anyone aborts their native natural latitude diet in favor of refined sugar and flour and now oil calories, there will be degeneration that will occur without question. And one of the most notable things that kind of hit me years ago this is 20 years ago because I moved to Florida to work at Palmer in Port Orange in the fall of 2002. And the way that their curriculum was set up, I happened to teach some anatomy stuff that involved histology and embryology. So I started studying that stuff, and I wanted to look into how to look at joint histology from a clinical perspective, rather than just, this is the tide mark, here are your horizontal collagen fibers and blah, 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 blah. So I came across research from Rutgers, where I went to college, where they found that over time, omega-6 fatty acids concentrate in articular cartilage, slow and over time. And when you hit a critical threshold at some point, even when there are no symptoms, the chondrocytes die, and there are little beds that they live in. They live in little houses called lacunae inside the articular cartilage, and these lacunae fill up with lipid. And so now the first paper that I ever saw published on this was in 1975, that osteoarthritic joints have an accumulation of omega-6 fatty acids, which is not the case for your non-arthritic joints. And I'm like, wow. So you got this microscopic change that they measured in the US, and then you have the Weston Price macroscopic examples of this. Oh man, this is just horrible. And so then I started thinking, because back at some point this is probably in I forget when, around 2000, when the clinical prediction rules for manipulation started to show up. If pain wasn't below your knee, and if it was localized and wasn't too long, you'd be a good a lumbar spine manipulation candidate versus longer term with radiating pain down below the knee. So the clinical prediction thing. And I thought to myself, I wonder if we could create, and no one has yet, a clinical prediction rule for lifestyle factors, because those are the things that DCs are the worst at. Yep. Understanding how and PTs too, the lifestyle issues, how they impact body motion. So here's an example. They did a study on, this was published in the journal Pain. They had people for 10 days, I think it was 10 days. I may be mixing up a couple of different studies, but anyway, sleeping for less than 6 hours a night for 10 days straight. Whenever they had, that may have been for an inflammatory, but whenever anyone sleeps less than they should, they have increased pain the next day. Yep. Independent of any movement activities at all. So if next day pain increases by being sleep deprived, well, that should tell us about you've just had your second kid. I remember, how old is your oldest now? 3?
Almost 3 in April, and then our youngest is
I remember
1
kind of seeing him born and grow and get a bigger version.
Oh,
well,
yeah.
You typically start to sleep less when you have a kid, right?
Yes.
And then, of course, if you sleep less, you tend to not feel quite as well as you do when you're sleeping enough. Well, there's a reason why. Lack of sleep just like any other psychological stressor, acts as a non-physical, like perturbation to our sensing nervous system. There's actually a collection of chemicals. And I learned about this maybe like 3 years ago, because I was always curious. I'm like, how does stress, not sleeping, psychosocial stressors, not sleeping, why is that inflammatory? And it turns out that we have in our bodies chemicals, they're called alarmins.
Hmm.
Biologic, they're called, they're called alarmins, right?
Yeah.
So if you don't sleep enough, the alarm is activated, and then inflammatory chemistry is released. And that's why you feel like crap if you don't get enough sleep. So I'm like, man, like this is, and I'm thinking to myself, okay, so lack of exercise, you need physiological stress. Without it, you activate the alarmins.
Mhm.
So these lifestyle factors, they activate alarmins and lead to chronic inflammation that will lead to degeneration over time. And then if it's too robust, then you end up looking like a Weston Price victim, and then nothing helps in terms of treatments.
Yeah, and I think you're right. A lot of DCs are forgetting a lot of the lifestyle factors that you mentioned, sleep, and then obviously nutrition is a huge part of that. And then we're trying to fix something and not
That's not
really,
fixable.
yeah, not fixable. And then you're getting referrals from other maybe orthopedists that are getting MRIs, and they're gearing everything towards maybe the mechanical and all that. And so there's just this huge gorilla, or in the room there, that you're just not seeing and not having those conversations with it. All right, docs, here is a new opportunity for you from Darcy Sullivan of Propel. She is our SEO specialist in helping out many chiropractors with their search engine optimization and making sure Google is finding you and getting you new patients. It's amazing how many new patients chiropractors can get and are getting when they do the SEO right, and a few other things. And Darcy is offering a free SEO workshop just for chiropractors, and you can sign up for that at bit.ly/propelmcm. That is bit.ly propelmcm, modern chiropractic marketing, right? And so check out that link, and we're going to have you go over 5 SEO secrets to owning the first page of Google without buying ads. And Darcy's going to give that free workshop, 1 hour, to really help grow your practice and start churning new patients from the ever mighty Google, which is still king in the online marketing. So check that out at bit.ly/propelmcm for the 1 hour free workshop. What are some of the things? Because I think a lot of times DCs get concerned that they're going to have to become a like full-blown nutritionist to be able to have an impact on their patients in regards to this. And I've always loved your DeFlame Diet and the books and the website and all that, because it really brings it down to a level where it can be implemented, it can be discussed, it can be digested, pardon the pun, by the patient, and ultimately you can make an impact. So kind of speak to that DC where they're worried, like, okay, do I have to go and get a full like semester of learning how to be a nutritionist? Am I going to spend an hour with the patient every time to discuss this stuff? Like, how do we integrate this into our practice, even the ones that are doing McKenzie method? Because you actually, we were talking pre-chat, you've taught McKenzie. I think that's something some people forget too, is you can manipulate people. You still do this day, McKenzie, like a lot of the stuff that isn't quote unquote nutrition, and you're able to integrate it. So how can the DC kind of bring that home to their practice and really help to start changing the conversation for their patients?
I don't know who it was who started, the fear. But that's the other thing too that's interesting. Part of it involves fear and concern, right? Like,
Mhm.
I don't know. I'm afraid of what I might open if I open that nutrition door, right? So,
Yeah.
so the second, it's really interesting. The second anyone has fear in their brain,
Mhm.
fear, it inhibits the frontal lobe, actually. A fear state is one where the prefrontal cortex gets inhibited, and it facilitates amygdala extensions wherever the amygdala is extending to. So fear turns off our ability to think. So whenever he hears, oh, you got to do something diet, like, oh, they start freaking out, right? Well, first of all, everybody who freaks out, they already ate that day, most likely, and their patient already ate that day. So it's not like this eating thing is new. And right, and everybody out there knows that basically vegetables and fruit and nuts and tubers and roots and those kinds of things are very, very healthy. Spices, very, very healthy. Some people want to be vegans. If you want to be a vegan, go ahead and be a vegan. If you want to be a carnivore, I don't know why, but most people are omnivores. And the only foods that they really need to get rid of are sugar, flour, and refined oils, unless they have a gluten problem, as the most obvious example, or individual allergies. And then all they should want to do is just normalize waist hip ratio. Waist hip ratio, if that's normal, the odds of you having pro-inflammatory body chemistry are very, very low unless you maintain that normal waist hip ratio by drinking corn oil, which you can. So you'll just have a very, very unhealthy body over time. But it doesn't need to be complicated. It just means that we want to normalize our waist hip ratio. We want to normalize our blood glucose. We want to normalize our waist circumference. And it turns out that waist hip ratio correlates robustly to all inflammatory markers. It's really stunning, actually. Even like circulating like endotoxin, which is the outer, it's called lipopolysaccharide. So it's a sugar fat that sticks in the outer membrane of gram-negative bacteria, which are in the gut and in the mouth. And in the gut, when the gut's exposed to sugar, flour, refined oils, that endotoxin is released and it gets absorbed. Well, it turns out waist hip ratio correlates to circulating endotoxin. So it is the most robust measurement that a DC can use if they've got amygdaloid problems with doing lab work. And they don't need to do lab work. But it does turn out that, well, you've seen people got a lot fatter during COVID.
Yep.
Children obesity has increased. Children diabetes has increased. So it would be good for DCs to get comfortable if their scope allows it to do blood sugar measurements. And I don't know. I've not talked to any of the of the boards about if there's limits to this. But really, a patient comes in, do a glucometer on them, and see where they are when they walk in, and track this. Anyone who's got a postprandial glucose, and after 2 hours, if your glucose is above 140, man, you got a blood sugar problem.
Yeah, I listened to a podcast, Peter Attia, MD, that has a pretty popular podcast.
He's that
and
carnivore,
like
right?
I don't think he is.
Yeah.
No.
Oh yeah,
Is
he's
he?
the carnivore guy, Peter
Is
Attia.
he?
Yeah. Oh yeah.
Yeah, but he does talk about having he wants people just wearing, having a blood glucose monitor like all the time.
Yeah.
If people would do that one thing, I mean, there's obviously other things you want to do, but if you could do that, you could really figure out and change a lot.
Absolutely. And it's not complicated. And the other thing too is people say, well, if I do that, because they already have fear in the first place, right? Or they're told you need to change your diet. They have fear. So now you have this frontal lobe that's already shut off. And then the next fear thing, well, it means I'll never be able to have a donut ever again. Nobody said that. So they start to catastrophize on their own for no reason, as opposed to, hey, when did you feel the best? When you were like 25 and weighed 100 pounds less, or now?
Yeah.
And so
it's so funny because a couple of days ago was my birthday actually, and I generally eat healthy, but part of the problem of having a 2.5-year-old is I hate seeing all the food go to waste. So I'm eating a little bit more than I should, although we feed them really healthy, so that's a good thing. But it was my birthday, and I was having a good day, and I felt good. I worked out, good energy. My wife had delivered these really impressive like cookie. It's just so ridiculous what they do with cookies now. It's like mini cakes, and you put it in the toaster oven thing and you heat it up, and it tastes like heaven. And I ate half of one of those things, and I felt like shit for the rest of the afternoon. And I was like,
isn't that crazy?
oh, I mean, it just tanked my day, but I knew going into it, I knew as soon as I was eating, it's like, this is going to suck, but it's my birthday. I can't not have one. She delivered it to you. And I felt like shit the rest of the day.
But it's pretty amazing how in some cases it can be that dramatic. I used to once in a while when I worked at one of the Cairo schools I worked at during the week, had lunch with a couple of guys, and we would go over to the wing place, and I would get naked wings and a Caesar salad, unsweet tea, no croutons, a little bit of dressing. So it was pretty clean, pretty clean baked wings. So this guy would get like the super deep fried everything with the curly fries, the whole thing, and a Coke. And we were going back to school after eating. He goes, every time I eat here, by the time I get like to the car and halfway back, like right now, I start to feel my hands feeling like this. So being that I'm, of course, like what? Like because I heard every time, and I'm
Yeah.
like, you're a DC. You treated patients once. You used to do a case history. What makes it worse? What makes it better? That kind of thing, right? So
Yeah.
here he is telling us, like almost unconsciously, my arthritic pain that I always have is way worse after I eat curly fries and deep fried wings with washing it down with Coke. And I'm like, every time? He goes, every time. I go, well, why don't you stop? It like didn't even occur to him. It's like, well, I guess
Yeah.
I got to go through this. No, you don't. Just don't do it.
Yeah. Well, I actually, yeah, I
That's
made a,
how bad our brain is for food too, right? Because it tastes so good, we don't want to give that up.
it is hard, it is hard, and I struggle with it for sure. But like I actually did make a rule, especially when I was treating patients. Whenever I would do a business lunch, which a lot of times like once or twice a week, maybe 4 times a month or something, I would not order any of that stuff. It was always a salad. It was like and because I had done that before, where I'd come back for the afternoon shift of patients after eating the cheeseburger and fries, tasted great, but I couldn't function. Like I could like taking a history of a patient and my brain is just like cloudy. So I stopped doing that definitely. And but then, I go out to dinner, we go out to some nice restaurants here and there, and it's just so hard to pass up. But I did it the other night. We had a nice steak dinner. I got a steak and vegetables, it was good.
Yeah, steak and vegetables works great. It's the additional stuff. It was really funny too. I forget where I was. Maybe after I played golf last weekend, and we're in the clubhouse. So we decide to get a meal, and the guy goes, "Oh, my doctor says I need to eat more fish." So he gets a fish sandwich, right?
Mhm.
And
I can see where this is going.
well, he just fish sandwich. We eat the whole thing, and then he just eats every French fry. And I'm like, looking to myself, like, I mean, you really think that a little bit of fish is gonna like combat that tsunami of deep fried of white powdery potato? It's like it doesn't even occur. I'm like, oh
Yeah.
man, these poor people.
Yeah. You know what I do now? I hate coleslaw. Um, so whenever I order something that's healthy, let's call it, but it comes with French fries, or you could pick the this or the that. I was like, give me the coleslaw because I'm not gonna eat it. So
Oh, okay, yeah, yeah, yeah.
versus like if they even bring the fries, I'll eat it, right? But I'm not gonna eat the coleslaw, so I tell them to bring that. So I just avoid it, and I'll eat the chicken breast and the veggies that come
Well, think
in.
about that, what you did there. See, that's a
Yeah.
strategy, right? Because
Mhm.
for marketing and patient management and practice management and office management, you need strategies for different situations so that you don't screw yourself up or make errors or you compromise or end up in a cumbersome scenario. So what you did there is really good strategy. And I think, the best way, like you're doing, is your threshold. Like if you can have two or three French fries, well, then have a couple. So I mean,
Mhm.
I think I got the same sandwich that guy got, and I had like three or four fries,
Yeah.
and he had the whole thing,
Yeah.
and
Yeah.
didn't occur. He thought, well, the fish will somehow counteract the fries. I'm like, man, it just doesn't work like that.
Well, and that's something I've always appreciated about you because I've had the fortunate opportunity to hang out with you and have dinners and play golf together over the years, and there's been times where you will eat regular, like, but it's within reason,
That's right. You were
and
shocked that one time, right? I had a Coke or
yeah,
something like that.
yeah, it
Diet
was
Coke.
back, oh, maybe 2009. We were playing golf and we hit the turn, and I remember it was me, Mark Hawkins, Mark King, and you, and we go to get some snacks at the turn, and I think you ordered it was like a Coke and something
Diet Coke.
else.
Not do
Yeah,
regular.
Diet Coke
Diet.
and something else. And I remember Mark Hawkins and I we look at you and like It was like, what the hell's going on here? You're not allowed to do that.
Isn't that funny though? We put these rules in our brains,
Yeah.
right? We put these rules in our brain, and that's the problem with nutrition, is it is
Mhm.
highly emotional, and that's why in every book and every article I write, I talk about markers, that you want to track your markers, and really waist hip ratio is a fantastic one. Waist hip ratio for guys should be below 0.95, and for girls should be below 0.8. And
Mhm.
so just get there. That's all. I mean, it's not that complicated. Don't over, because everyone, it's really, it's interesting. I've run into a lot of people over the years where they shred down like crazy. This, I did the whole thing you're doing. And then I see them a year later and they're fat as a
Yeah.
house again.
Yep.
It's because they don't have the right mindset for it. Everybody wants to eat that crap. I probably, yeah, have pizza and a beer once a week.
Mhm.
You okay with that? Are you okay with that?
I love it. I love it. Because no, because it brings it down to earth too, and it makes you realize like because we do see the people that are 100% clean in their eating, and it's like insanely meticulous, and I think that's the misconception that people have, is that I have to go from where I'm at now, which say is not in a good spot, to being that perfection of eating, and I think that scares some of them. And I think if you level with your patients, like you're talking about, and instead of making it this thing where you're adding a bunch of things or adding this entire program, you start with like, let's remove these categories of stuff,
Yeah.
and that's easy. And then look, you don't have to be 100% perfect all the time, but if you do this, you set a goal of, like you said, the waist ratio, and you like really reasonable things with the blood glucose, and do all that. You add that, like, because it's ironic, because the same chiropractors, and I fall into the same categories, we can't believe that they don't follow the rehab exercise program at home that we give them, that's got 43 different exercises, and
Right.
we're shocked that they're not doing it. But then we don't think they can handle a 10-minute 5-minute conversation on the things to remove, with some nice handouts that I know that you have, that like where they could actually do that. So it's like, it's just ironic that we on one hand think they can handle all this at home exercise program, but they can't handle some advice here that's going to really make a big difference.
Yeah, I used to tell people when I was doing some golf rehab stuff, particularly a handful of golf pros. This guy wouldn't play anymore because his back was killing him. He drove back and forth to work. He said, "Well, here's what you do: only drink water when you're going back and forth. Drink black coffee. Don't throw sugar in there. Want a little cream, no problem. Otherwise, do tea. Eat, avoid sugar, flour, refined oils. And when you're riding 45 minutes back and forth to work, I just showed him to do some abdominal bracing."
Mm-hmm.
Good posture, abdominal bracing, that kind of stuff. And he emails me like 3 months later. He goes, my back, I lost 40 pounds. My back pain is totally gone, and I can play golf again. All I had him do was abdominal brace and
Mm-hmm.
think about not filling his braced belly with French fries. And that was it. A
Yep.
massive change without a whole lot of stress or anything like that. No pressure at all. But we put this weird pressure on ourselves. And I think part of it has to do with, again, sort of like I don't know, the catastrophizing that the
Mm-hmm.
average person goes through when they hear they should change what they eat. You can
Yep.
still have French fries, just not buckets of them. And you want to
Mm-hmm.
achieve a normal waist hip ratio. If you achieve a normal waist hip ratio, your chance of also being a responder as a patient goes up dramatically.
Yep.
And the other thing too is for the DC, if they're overeating their calories, and listen, everybody listening, trust me on this. Go to Google, put in Weston Price, look at the pictures.
Mm-hmm.
If you are hypercaloric and your waist to ratio is higher than it should be, you are in the process of going from a healthy, lean person, which most of us were, into one of these degenerated Weston Price people. And now, if you're doing a lot of, say, lumbar rolls on people, side posture, where you're doing a good move,
Mm-hmm.
the shoulders take a beating.
Yep.
So you know how common tendinopathy is in people with hyperglycemia? Pretty
Mm-hmm.
much. It's been very, very, it's almost a perfect, not perfect correlation, but there are outliers, of course. As blood glucose goes up, as obesity goes up, everybody knows that you push yourself towards atherosclerosis. I mean, it goes
Mm-hmm.
hand in hand. As your glucose goes up, so does your chance for cardiovascular, cerebrovascular disease, impotence, peripheral artery disease. They all go up together. But what people don't know is that that degenerative process that occurs in the arteries is mirrored in tendons and joints. So you're sitting there blasting away on somebody, and now all of a sudden you got this beat up supraspinatus tendon that needs to be that needs surgery. Well, why? Because you ate yourself into that direction, and every day you're pounding people. That's wear without giving you a chance to repair, especially when it becomes, atherosclerosis, which is literally, you can literally see papers. Is osteoarthritis a vascular atheromatosis disease of joints? And the chemistry is nearly identical.
Hmm. That's interesting for sure. Now let's segue a little bit because I know the audience can't see it, but I can. And you've doing some work with golf, and you always have for a long time. But now we've got the DeFlame Diet for golf. Is that something that's been on your mind for a while that you needed to get out into the ether there to educate and stuff? And what is some of that you're doing?
Well, once the COVID thing hit and I stopped traveling on
Mhm.
weekends, I'm like, what's this? 3 days where I'm on like a Friday afternoon, and what is this?
Mhm.
Is interesting. I haven't had this experience in years, so I started playing a
Mhm.
lot.
Yeah.
So the first thing I did was I at the club locally uh, is where Mo Norman, a famous Canadian pro golfer, he lived in Daytona Beach for like 45 winters. So half of
Mhm.
Mo Norman's adult life, he lived in Daytona Beach, and he was crowned the best ball striker in history by the PGA back in 1994. So the first time I played golf, actually I played golf. It actually worked like this: Mark King was down in June. We played golf.
Mhm.
A month later, my father and brother were down. We played golf. My dad and brother were having a beer. I had a Guinness, in case people are wondering. Although I don't always, I do like IPAs. But so I'm having a Guinness, and I look at the
Mhm.
plaque on the one. I'm like, Mo Norman record here, Mo Norman there. And a guy walks by and goes, "Hi, how you doing?" And he introduced himself. He's the owner. And I go, "Mo Norman." He goes, "Oh yeah, he lived upstairs for 3 or 4 winters in the late 50s." I'm like, "Wow."
Right.
So I go home and I look up Mo Norman, and I see him doing it was like two 25-minute videos of him in a
Mm.
green pants, yellow plaid shirt with like orange in it. And this British guy's talking to him. Turns out the British guy teaches over at LPGA right here in Daytona.
Okay.
So I was watching Mo Norman talk because I saw pictures of Mo Norman years ago. And then I'm watching Mo Norman explain why he does what he does. He stands farther away from the ball. And he explains, well, the reason why is because it gives me room. I don't have to get my body out of the way. It doesn't require all this. I'm like, I stand up through impact like most
Mm.
amateurs do.
Yeah.
Let me back up and see what happens. So I back up, and in 6 months, I go from a 12 to a 6 just by backing up. So my mind goes, well, what else don't I know? So then I end up writing a 300-page book called The Amateur Golfer's Dilemma, all about causes. It's like the underlying inflammatory problem in the golf world. Not inflammation, of course, but similar things. Like the two main things for golfers: we stand too close to the ball, and we don't know how to dynamically move from our heels. We get onto our toes with forward momentum.
Mm.
So that's the golf book. Prior to that, though, I figured I would just modify my joint rotting book, my version of nutrition and physical degeneration for golfers, and that's why it's called the DeFlame Diet for golf. And
Mm.
so, yeah, I'm branching to that. I've got my website, my homepage is up. It's called The Amateur Golfer's Dilemma. And all I do is not harass, I make fun of the stupidity of standing too close to the ball and not swinging from the heels. And I use multiple examples of PGA teaching pros who first of all, can't do what they're teaching us.
Yeah.
They stand too close to the ball and they go up onto their toes. So it's been a lot of fun because you just see some of the remarks I get. It's like, man, I didn't know
Mm.
people were this not very bright. It's
Yeah.
pretty huge. So it's just like, how do I eat better? Waist tip ratio, pull back on the sugar, flour, refined oil calories,
Mm.
and within a very short period of time, people's symptoms can dramatically improve, which is no different than just standing a little bit further away
Mm.
from the ball. So I guess as I enter the final third of my life, which will be the final 6 holes of my life, I think golf will be part of it.
Good. I love it. Yeah, and it's something that's always you can't learn enough, right?
Oh yeah,
It's
yeah.
great. Do you think there's any, there's obviously I had a great experience in the past working with some pro golfers and traveled on PGA Tour a little bit. I saw some of the habits and stuff. Obviously, most of these high level golfers now have trainers and chiropractors and massage therapists, and they have all the physical stuff. We're obviously dealing with a lot of low back injuries, and even in the highest level golfers. Would you suspect there's something going on there, maybe with their nutrition? I know they travel. I mean, I know they have the resources, but have you had any insights on that?
I think prior, isn't it true? I mean, I've heard from various people, and I've actually watched golfers because the handful of tour events I got where I was able to be inside where the players were. I mean, they eat a lot of crappy food.
Yep.
So not all of them, but and I think Tiger Woods was basically a burger and fry and a Coke guy for a long time. You know, it's hard to really say because it's a protracted thing over time. Most of these guys have a proper waist to ratio, but if you have too much dietarily consumed advanced glycation end products, it puts a burden on your musculoskeletal tissues because these advanced glycation end products, as well as other chemicals, they create localized inflammatory events that tend not to heal serially over time, so it looks like a tear event in the end rather than as opposed to being a degenerative event. So I would say that long term, yes, like you can maintain normal weight for 20 years, but if you eat too much corn oil, you're probably going to get cancer, even though your weight is normal. So those calories become very important, particularly if you're doing basically repetitive motion activity, which is what golf is, obviously.
Yeah, definitely. And I think, a little challenge to our chiropractors, and you mentioned it, is that, part of our responsibility as a chiropractor, it's a very physical job, and we have to keep ourselves healthy. And whether that's sleeping well, exercising regularly, making sure our technique is good, making sure our mindset is there and we're present with our patients. It's a hard job. There's a lot of facets to doing it. And the physical is such a big part of it that if you need to clean up your own diet, that could be the start of grasping this information and living it. And then you'll be able to really convey that information to your patients even better and use yourself as maybe as a case study, right? An example of like, look what I did. If because we're getting a lot of these disc injuries, we're getting a lot of this stuff, and we're missing that part of it. And if you start to really communicate with your patients on it, I think it's gonna make a big difference.
Well, the other thing too, actually, is that, and it's been documented quite well, type 2 diabetics have reduced motion across all joints compared to age-matched controls. And type 2 diabetics have a much higher incidence of cervical and lumbar spine disc herniation. If you have to have surgery, whether it be, well, really anywhere, but spine is my interest, of course, much
Mhm.
more likely to have a complication post-surgically than if you have normal glucose. So figure out what your French fry and donut titration level is, and
Mhm.
keep your glucose normal and keep your waist to ratio normal. And then this will not be a stressfully burdensome scenario, a catastrophizing state that the mind goes through when you realize you got to basically clean up your lifestyle. I mean, it's not that complicated. I mean, it really isn't. And native cultures, if you look at the Weston Price pictures and you look at the natives who, because Weston Price is a density, had them smile. And you see these like beautiful people with beautiful smiles. They look happy. They're not sitting there going, shit, what's wrong? No donuts yet. You know, French fry machines haven't arrived yet to the Brazilian, rainforest. Our lives suck. Like, they don't give a shit. Their lives are great. They can move, they can run, they can do all kinds of stuff without pain. They have got great lives. And what's the American thing? Oh, I mean, I can't have dessert. Like, oh, geez, this dullard kind of mindset that these people live in. I
Yeah,
can tell
no,
you, I'm 62 now, and 62 is not 40. I don't know who said that. 60 is the new 40. Probably some hopeful 30-year-old. It ain't the case. But I can tell you, though, being 62 compared to a lot of guys who are 10 or so years younger than I am, playing golf with them, and I hit it farther than them. And I don't have the mobility that I had 20 years ago. But man, I mean, it would be no fun to like have to hit woods into short par fours like a lot of the guys I play with. I mean, I play with guys 350 hole. They're hitting like 5 woods into a 350 hole, and I'm
Mhm.
hitting a pitching wedge or sandwich. So I'm like,
Nice.
God, it's not fun.
It's not. And so, Doc, I really appreciate your time today. This was great. How could our chiropractors that are interested in to really start to integrate this seamlessly into their practice? How can they find more resources to get this going for them?
So the fastest, cheapest thing that they can do is they can go right to their search field, like Google search field, and just put in BMI pain. And the first or second paper that will appear in all the searches is a paper that I put into chiropractic and manual therapies, I think it's called. And it's called BMI pain connection. I forget the exact title of it. And that lists all the markers. And then they can go to DeFlame.com where I have all 7 of my books listed, and they can get volume discounts there, or they can get individual copies if they click through right to Amazon. And then 2 YouTube channels. One is called DeFlame Nutrition, like 100 some odd videos there. And then the other one is the Amateur Golfer's Dilemma, about 40 videos there. So, and I didn't want to have any commercials, but now YouTube reserves the right to put commercials on. So I got commercials. Sorry about that. But
Nah, that's all right.
those are the spots.
Perfect. I love it. All right. Thanks for your time today, Doc. I appreciate it.
Hey, thanks for having me.
I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time-free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth, and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things, and we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.